Lung cancer is a common problem nowadays. It is one of the most commonly diagnosed cancer worldwide. If we see the Indian scenario, the lung cancer is the most common cancer diagnosed among the Indian male population, as well as it is the most common cause of cancer related mortality in the Indian males. So in nowadays we come across many of the lung cancers which are being diagnosed, as well as if we see the Indian scenario, the highest incidence is seen in the Mizoram across the India. Almost the lung cancer constitutes almost 7% of all newly diagnosed cancer in India, while it also constitutes 9% of all the cancer related mortality in Indian scenario. So overall this is a more commonly diagnosed and one of the most commonly diagnosed cancer. So if we see, the incidence of the lung cancer is rising nowadays drastically. So what are the common causes that are responsible for the development of the lung cancers? So if we see, the 85% of the lung cancers are related to the smoking itself. So it is the most important risk factors for the development of the lung cancer. So that may be smoking of either a tobacco related or a smoked or a smokeless tobacco. Both consumption of these both types of smoked as well as smokeless tobacco leads to the development of the lung cancers. So it is the most important risk factors, and if we really want to prevent the development of the lung cancer, just avoiding the smoking can be of the paramount importance. Apart from the smoking, there are other risk factors that are related to the development of the remaining cases of the lung cancers. Among that, the common ones are the exposure to some chemicals like asbestos, exposure to radon gas also, that has been implicated as an causative factor for the lung cancers, and very rarely the genetics plays a role. So apart from these risk factors for the development of the lung cancers, the common symptoms what we see in a lung cancer patients are, these are the common related to the localized disease related symptoms like development of the cough, a long standing cough, development of the expectoration, maybe presence of the hemoptysis also. Hemoptysis means coughing out blood in the sputum. Patient may also present with non-specific complaints like development of the weight loss, loss of the appetite. Then focus on the earliest diagnosis as well as treatment of the lung cancer. Whenever you come across the symptoms like like cough, expectoration, like hemoptysis or breathlessness or any development of the nodes in the body, then we should immediately approach to our family physician, maybe a cancer related specialist at the earliest for early diagnosis as well as treatment. So let us come together and let us fight cancer together. Thank you.